This week's Independent Sage briefing today on the 1st of April 2022. Today marks the end of free COVID testing in England. Access to free lateral flow tests for people without symptoms will be restricted to select groups, including patient-facing NHS staff and social care staff. Scotland will phase out free testing from mid-April, and it looks like Wales and Northern Ireland are expected to follow suit in June. Of course, this move comes at a time when infection rates are at record high levels in certain parts of the country and remain at record high throughout. The removal of widespread testing and the protective measures, of course, will raise alarms in relation to the high levels across the country, and those who are vulnerable, those who are immunocompromised, and those who are much more exposed to this virus in deprived areas, who have public-facing jobs, will of course really worry. And on top of this, there is the issue of costs of lateral flow tests, and there are many groups out there right now who for lateral flow tests will pose really expensive items, and for whom the option of self-isolating will prove really difficult. So we are in an extraordinary time right now. Now, this makes it even more important than ever that we create safe spaces. We create safe spaces at work, we create safe spaces in communal areas for staff, for customers, for users like all of us in these spaces. So today, this is going to be the topic of our discussion. And we have a number of guests from the trade unions who will be joining us, and Professor Stephen Reicher will be leading on that discussion. But before that, as always, we have our inimitable COVID numbers expert, Professor Christina Pagel, who will be talking us through the latest numbers and trends. Over to you, Christina.
Thank you. Right, let me share my screen. So it's not a great week, I've got to tell you. This week the data is pretty grim, but I'll be going through vaccination, prevalence, hospitalizations, deaths, and then a little bit on the latest data on protective behaviours, and then just to kind of set up the discussion with Steve Reicher later, a little bit about occupations and COVID. So on the vaccination front, we're not really giving any vaccines at all in terms of first dose, second dose, or third dose. We still haven't finished, but basically since I think, middle of January, numbers have basically come to zero. But we have started the spring booster dose for over 75-year-olds and people who are severely immunocompromised. Now, the good news is that this group already has really high coverage of their autumn booster, 79% of people. And since the 18th of March, 12% of people have received their fourth dose. There is recent evidence that's come out of Israel that a fourth dose is protective against hospitalization and death. So I really urge people who are in that category to go and get it. You can book it online or go to a walk-in clinic. On prevalence, the latest ONS data came out today, and I remember this is done weekly with a random sample of people. It doesn't depend at all on testing behaviours, so it is the gold standard for how much COVID there is around, and they just test, say, tens of thousands of people every week and see who comes out positive. And we're, as Zubaida said, we're at record high levels. In England and Wales, we are now far higher than we've ever been in the pandemic. Over 7%, 7.5% of people in England currently testing positive. Scotland broke the home nation's record last week with 9% testing positive. That's come down a little bit this week to 8.5%. But what we can see from Northern Ireland, who had the BA2 wave much earlier in January, that they've really kind of fluctuated up and down, up and down, up and down for about 6 weeks now. So that's kind of what's not clear is what's going to happen. Are we going to peak? Are we going to keep going up? Are we going to stay at this high level or come down? The other thing to bear in mind as we look at the rest of the data is that Scotland's BA2 rise, which is what is prompting the latest rise plus changes in behaviour, started about 2 weeks before England and Wales. So when we're looking at things like hospitalizations and deaths, Scotland is ahead of England and Wales. England and Wales are pretty much tracking each other exactly. Every region in England has gone up. At the moment, by far the highest prevalence is in the southwest of England, and also a really big recent surge just week on week. Over 9%, almost 1 in 10 people in the southwest of England currently have COVID. We're also seeing that all ages are going up. There's no bill let up in school-age children. Primary school children is still the highest proportion in the age groups, with almost 9% being infected. But what is more worrying is you're seeing really big increases now in people over 50 and people over 70, with almost 7% of people infected. And if we just look at the over 70s over time, you can see quite how much higher it is than the BA1 wave in January. So this really is a bit of a worry as we think about hospitalizations and deaths, even though luckily a lot of these people are boosted. So looking at admission data, this is a plot of just a number of people in hospital for each nation. Now you can see that Northern Ireland is coming down, but still high. And really Northern Ireland's been pretty high ever since the summer. And their kind of BA1 wave and BA2 wave were squashed together. They didn't have a dip in between. So although it's good that it's coming down, if you actually look at their admissions data, that's pretty flat. And if you look at their ICU data, their intensive care data, that has actually just started going up again. So it's not quite clear what's going to happen there. All the other nations are still going up. Scotland is at its highest levels ever. If we look at admissions, this is the number of people admitted to hospital every day. This is in England with COVID. We're back at the Omicron peak here. So we're back at well over 2,000 admissions a day. But this is likely to keep going up for at least another week because we've not peaked yet in England. And we've just seen the really high rates in older people. So unfortunately, I'm so sure we will exceed this peak, but hopefully for not too much longer. Because if we look at Scotland, you can see that although the hospitalizations in this wave definitely were much higher than the BA1 wave, that it is now coming down. So hopefully admissions in Scotland have peaked for this wave. And just looking at it by, people talk about, it's incidental COVID and driving the increases and all the rest of it. It's not. What's happening is that as COVID is spreading in the country, admissions who are both, incidentally with COVID, but also directly because of COVID are going up pretty steeply. So we can see that here. And it's pretty much exactly the same pattern that we saw with Omicron in December. It's just that then it started with a much higher baseline from the end of the Delta wave. So this is also impacting NHS staff. So the percentage of NHS staff off sick is still going up and is much higher than the previous 2 years. So that is also causing additional strain. Looking at deaths, I'm just looking at the deaths from the Office of National Statistics. So this is deaths that are on the death certificate where COVID is ascertained to be on the causal pathway. So these are deaths from, not deaths with. Looking at just Northern Ireland first, you can kind of see, this is going back to September 2020. So this is the big alpha wave in 21 and the delta waves over the summer and autumn. And as I said, the Northern Ireland kind of Omicron wave has been mashed together. They didn't have a separate BA1 and BA2 wave. And they've just had kind of quite stable, relatively high compared to no wave deaths, but lower than Delta for the last few months. It does look like most recent data is that has come down a little bit. In England, you see a really enormous alpha wave and a kind of a long, prolonged Delta wave. And this is the Omicron BA1 wave in January, which happened about 2 weeks after ONS prevalence peak, which was the first week of January for BA1. Now, this goes up to the 18th of March. So we haven't seen the impact of the current BA2 wave yet, but we will see it, because we are seeing it now in Scotland. So this is the data for Scotland. So you can see the BA1 wave here in Scotland. They also had peak prevalence of BA1 the first week of Jan. So 2-3 weeks later, they saw the peak in deaths. And just in the most recent week, we had a big spike in deaths with COVID on death certificate in Scotland, a 60% increase week on week. And unfortunately, this is likely to stay at this level for a little bit at least, because we know that Scotland's probably only just peaked, if it has peaked. Just looking out at protective behaviours. This is from the ONS coronavirus report that came out today, and this is just looking at the percentage of adults practicing different preventative measures over time, over the last year or so. So the top is mask wearing. So you can see mask wearing was slowly falling off over the autumn, went up again during Plan B in the first Omicron surge, but has now dropped precipitously. And this can really only be about perception and mandates, because the prevalence is as high as it was. In fact, it's higher than it was. So this is kind of, I think, people responding to what they perceive and what is, or rather is not, being reported in the media. And obviously the government has not been having press conferences about this wave. Lateral flow tests are lower than in the original Omicron wave, just but are now going up slightly. But again, social distancing, which kind of stabilized and went up a little bit during the first Omicron wave, is down again. And if we actually look at, this is a slightly different survey from ONS, looking at people who are self-isolating. This is people who reported leaving the house wearing a mask. So while they have symptoms of COVID, or while they have COVID, and you can see that actually there's been quite big drops in the number of people who report wearing a mask when they're symptomatic going outside. And that is, you know, quite a big problem. And particularly, as Steve Reicher will tell you, this is quite an unrepresentative sample of people. These are people who are most likely to adhere to guidance. And this is the number of people who reported self-isolating. And this has been like very steady at 80% for over a year. And again, Steve Reicher has said this is unrealistically high. But you can just see, even among this population, there's been a really big drop over the most recent period. So clearly people are getting the message that the pandemic is over, even though it clearly is not. And we can kind of see that it's more likely to be messaging than ability, because there's no real differences here between income security, job security, and deprivation, at least in this data. So just finally, something on workforce. The first thing that I think is relevant and I want to highlight is that the UK has one of the lowest sick pay rates in Europe. And what that means is that people, firstly, from any disease, if they're feeling sick, are more likely to go into work when they feel sick, but also means that they're much less able to self-isolate if they need to, or feel that they would otherwise. And not only are people don't have access to good sick pay, the less money you earn, the less likely you are to be able to work from home. So this is hourly earnings. So the higher you are up here, the more you earn. And this is how likely you are to be able to work from home. So you can see that the less you earn, the less likely you are to be able to work from home. So you're more exposed yourself to getting COVID. And should you have COVID, you're more likely to infect other people. And we can see that COVID is now a significant cause of workplace absence. So it is affecting the economy to have COVID so highly prevalent in our society. It doesn't come cost-free. And this is just, this is from 2020 data. There hasn't been more recent data, but this is from 2020, so the first year of the pandemic. And the grey bar is sickness absence in 2019, before the pandemic, and the orange bar is during the pandemic. And you can see that if you weren't a key worker, so basically if you were able to stay at home, especially during waves, you're actually less likely to be sick than you were in 2019. For key workers, particularly in health and social care and food and necessary good and education, you're actually more likely to be sick. So there's a kind of exposure issue there. And we can see also when it comes to death rates from COVID, this is for men. You can see that and basically work outside the home and where you're mixing with lots of people, you did have a higher death rate from COVID than in professional occupations. And just the very last slide I want to show is that this is a crude vaccination rate, again from ONS data, by occupation group between adults aged 18 to 64. So green is booster, dark blue is 2 doses, and this this colour blue, is no doses. And you can see there is quite a big gradient, and there's a lot of variation between different trades. So health professionals, teaching, corporate managers and so on have the highest rates of vaccination, and skilled trades and other trades actually have the lowest levels of vaccination. So that also has to be thought about when you're thinking about workplace safety and people going to work or not with COVID. So just to summarise, the spring booster programme has started. It's still in its early stages. ONS shows that the number of people with COVID is rising in England and Wales. Scotland has likely peaked, and England hopefully will peak this week, not least because the Easter holidays are coming up for schools. But the question is, are cases just going to stay really high as they have in Northern Ireland? Are we going to be like at this level of COVID for quite a few more weeks? The number of people in hospital is increasing everywhere except Northern Ireland. Deaths are flat in England and Wales, reducing in Northern Ireland, but they are going up now in Scotland, and they are likely to go up in England and Wales too. So those on the lowest incomes are least able to work from home, and they're least able to stay home if sick, given inadequate sick pay. And I think with that, I will hand straight over to Steve Reicher.
Thank you very much, Christina, for that incredibly illuminating presentation. And it shows us, of course, that we are in an extraordinary situation at the moment where we've got a government that's sending very strong signals that COVID is over, when the numbers, as always, tell us a very different picture. The numbers in terms of infection rates, in terms of hospitalizations, in terms of absences from work, tell us a completely different picture. And I think it is worrying. We've got very high infections among school children as well as over 70-year-olds. Now, without any further ado, I'm going to invite Professor Stephen Reicher to introduce our extraordinary guest today, our amazing guest today, to kick off our discussion on safer workplaces and communal areas. Stephen.
Hi. Well, today, yeah, indeed, we are going to be talking about workplace safety. And of course, for many of us, the workplace is the public space where we spend more time than any other. So it's a critical issue. And we're going to do it with, as Bela has already said, a rather stellar cast. I'm going to co-host this with Janet Newsham, who's been a guest before from the Hazards Campaign. And then we'll be having a conversation with three trades unionists from different parts of the country. So we will start with Tracy Edwards, who's from Public and is it Communal Service? I've got that wrong. It's from the Civil Service Union. I'm sorry, Tracy, my first error. Then secondly, we'll be talking to Ceri Williams, who's a policy officer with the Wales TUC, and also to Dave Moxham, who's Deputy General Secretary of the Scottish TUC. Now, as I say, the workplace is absolutely critical, but it's not only critical for those who are working there, because restaurants are workplaces, pubs and clubs are workplaces, libraries are workplaces, so they're critical also in terms of the safety and the health of the users of services for the customers in shops and pubs and clubs and so on. So it affects all of us in a very major way. Now, in fact, there is a legal obligation of employers and owners to make sure that the workplace is safe. There is legislation. So it's not that we're asking for anything that isn't already there in law. It's simply that it's not being observed, or if anything, it's being observed in the breach. So there were some extraordinary figures that came out after a year of the pandemic. So in the midst of 2021, figures came out which showed that there'd been over 3,500 outbreaks of COVID in workplaces. There'd been over 18,000 complaints raised about lack of proper procedures in workplaces. And yet, less than 0.2% of those had led to any action at all. The normal figure, the figure in 2019 before COVID, was 20%. So there was a 100-fold drop in the actual extent to which anything was done, and the health and safety executive intervened in any way. And in part, that wasn't surprising, because just like there had been a lack of preparedness, austerity had led to the decline of beds in the NHS, to the lack of PPE. So the health and safety executive had been slashed and only had about half as many inspectors. And in fact, many of the inspectors were private sector, had been outsourced. So there's a real problem of health and safety not being addressed, not being taken seriously. And so the question we're going to ask today is, number one, what is actually happening in the workplace? What are the realities? Are workplaces safe, and how can they be made safe? What should we be doing? And we're going to be asking that question in general terms, but also launching a very specific initiative, which is around a pledge, which we're going to be asking employers to sign to take health and safety seriously, and take one issue particularly seriously. Because of all the egregious acts by this government, ending self-isolation for those who are infected and taking away support for self-isolation for those who are infected is possibly the worst. It means that people who are infectious will be wandering around within the community. And as Christina has shown, for many people, they simply can't afford not to work, and they can't work for home. So they will be being forced into the workplace. And some employers, as we know, are requiring workers who test positive to come into the workplace. And that's a major issue, not only for the workers, but also for any customer or any service user who goes into those. So the pledge has a specific focus on asking companies to ensure that they support their workforce to stay at home if they're infected. But Janet now is going to say a little bit more about the pledge to introduce it to you, and then she will start off the conversation by talking to Tracy. So over to you, Janet.
Thank you very much. I'm really pleased to introduce the Safety Pledge to you this afternoon. It's aimed at employers, as you heard, publicly declaring their commitment to controlling the COVID infection risks in their workplaces, and also to continue the best public health advice, to using the best public health advice to support workers who test positive, not to instruct them to go into work, as we've seen some employers do. But of course, we want them to do much, much more than the legal minimum. We want a precautionary approach to controlling COVID infections risks in workplaces. And as we've heard, workplaces include lots of places that we don't perhaps think of as workplaces: shops, hospitals, hotels, care homes, public transport, universities, postal depots, factories, offices. And we want to use the leverage that the pledge of this pledge to get as many employers as possible to sign up to it, to put a copy of it in their building windows, to put it on their websites, to provide workers, service users, customers with the confidence that they're controlling infection risks and the actions, despite the actions of the Westminster government to ignore and pretend COVID has magically gone away. And if they won't, then the business, they're putting the businesses at risk, the services at risk, because consumers will vote with their feet. They won't support them. They won't attend their venues. They'll prefer to shop elsewhere. And the choice is theirs. So anyone's listening today, I'd urge them to approach their own employers, approach the places where they go to, and ask them to support the pledge. And you've seen, hopefully, the pledge looks like in a minute. It's a pledge to protect our staff, users and consumers from COVID-19, and that they'll assess the physical environment and working practices according to health and safety law, including risk assessments, in order to ensure that they're designed to safeguard against the spread of infection, as you now see on the screen. We'll abide by the best public health advice and ensure that all employees who test positive for COVID are both asked and given adequate support to stay at home and self-isolate. So it gives me great pleasure now to be joined by Tracy Edwards, who's from the National Office, who's a National Officer, Responsibility for Health and Safety in the Public and Commercial Services Union. So Tracy, what's been your experience of the reality of health and safety in the workplace during the pandemic? Are employers meeting their legal obligations to mitigate COVID risk?
Yeah, thanks, Janet. Well, I think it depends on where you work. If first of all, depending on the employer you work for, and also as well, if you happen to work in a well-organised workplace, if you have a trade union in your workplace, our reps have been battling over the course of the pandemic to hold employers accountable. And most workplaces don't actually have a functioning health and safety regime. in place, and again, pre-COVID, we could see how health and safety had been relegated, not seen as important, and so this left, I think, many employers and organisations unprepared. I think this was also compounded by the ever-changing government advice, and quite often as well authoritarian messaging that came out from the government, because the fact is that employers didn't really know what to do, and also as well, I think that they knew they wouldn't really face any enforcement action by the health and safety executive, which has been cut by over 50% since 2010. So I think the reality is that good employers are few and far between. And I think that, as Christina pointed out, there's a lot of class and health inequalities around the decision that employers are making around health and safety. There's also the question about whether employers are equipped enough and that are knowledgeable enough around the Health and Safety at Work Act, around the regulations that flow from that. But I think it's been it's really shone a light on how shoddy in general the approach is to safety in the workplace nowadays.
I suppose following that then, what are the key changes that we need to make workplaces safer?
Yeah, well, I think first of all, I think everyone needs to join a trade union and organise to get improved health and safety arrangements. Everybody, remember, under the Health and Safety at Work Act has a right to a safe place at work, and that's really on the employer, and we need to collectively campaign and change the culture around health and safety. I think secondly, there needs to be a strengthening of existing health and safety laws and harder enforcement action when employers breach health and safety. I think the third thing that needs to happen is that there needs to be a change in the law to protect workers, to allow them to refuse to attend their workplace if it's unsafe without any repercussions, and to enhance and recognise the role that trade union safety reps play, who should, in my view, have the power to close down a workplace if it is unsafe. And then I think finally, in the long term, Janet, I think we need to have a review of buildings. There needs to be some capital investment provided, and to look at how those buildings are designed. As part of this, health workers should have a say in how their work is managed, not dictated to, and HR policies that support the health and safety agenda, such as full sick pay for all, and an end to the practice of penalising people for being off work. I think that this needs to be a combined effort across the TUC and the workers' movement, in conjunction with scientists, academics, and specialists such as engineers who are friends of the trade union movement, to pull together an alternative vision for the future, so that we never have to go through this again. The aim being to have safe, clean, and supportive working conditions and environments in the long term. And I think that everyone can agree, given everything that we've gone through, is the least that workers in this country deserve.
Thanks, Tracy. I'll pass back to Stephen.
Okay. I think one of the things we in Indie Sage are occasionally guilty of is that we talk about England as if it was the UK, and when we talk about the UK, we're talking about England. And I think it's important to recognise that things have been rather different in many ways in Scotland and in Wales, and that it's important to focus on those differences and the prospects of what might happen. So I want to ask about Wales and Scotland. I want to ask about what the current situation is in those two nations in terms of health and safety, and also what are the prospects in those countries of getting parliaments to act in ways that give health and safety real teeth. And I'm going to start off with Ceri Williams to talk briefly about the situation in Wales.
Hi, how are you? Yeah, well, I think the situation is different in Wales. I'm glad you said that. And I think we do have this different system of government here, a consensual one where it's proportional representation. It's not winner takes all. So that means the government has to proceed with more consensus. And reflecting that as well, the decisions around COVID have been informed by social partnership. The government meets regularly with the trade unions, employers and business together, and those outside organisations such as trade unions do have a direct influence on the COVID regulations in Wales. So I think that sort of modern consensual approach has helped. We have seen, you know, regulations which are more cautious have lasted longer in Wales than they have in England. So to bring us up to date today, as of Monday, it was only on Monday that the need to wear masks in shops and public transport was removed. So that's regrettable in a way from a trade union point of view, but at least it was in place for longer. Risk assessments are still required for the next 2 weeks at least. And in response to the figures that Christina was talking about, the Welsh Government's decided to keep the legal framework in place for COVID regulations. And also, to pick up another point Christina made, there is a £500 self-isolation scheme in Wales for those people on lower incomes until June at least. So thanks to our system of government and the approach and this consensual mechanism that's in government in Wales, we have had more sensible regulations that have protected workers and the public for longer. Not perfect, but better than other parts of the UK. On the other hand, implementation isn't so good. So we did a survey last year and we found that only 46% of workers said that employers had actually carried out a risk assessment, and only 1 in 4 had been consulted on that COVID risk assessment. And that's despite that being a legal requirement, you know. So that's the role for the health and safety executive to ensure those risk assessments are taking place. So we have got a gap there in terms of how it's implemented, how it's regulated, and how it's monitored by the state.
Thanks very much for that, Ceri, and thanks for pointing out actually that I made precisely the mistake that I warned against when earlier on I talked about the support, the £500 being taken away. I hadn't realised it's still there in Wales, and yet another reason why we should all move to Wales, and as we will hear, or move to Scotland in due course. But with that, I'll move on to Dave, if you would like to address the same issues and tell us about the Scottish context.
Thanks, Stephen. Thanks, everyone. Yeah, I mean, similar to Ceri and in Wales, I guess we would generally categorise our dialogue as trade unions, but also with business, as being more engaged, more consistent. And I think it's fair to say we've been able to apply more influence as a consequence of that in terms of the Scottish Government's approach to public health, but also workplace health. Specifically, it doesn't mean that we've had everything that we want to. I think when we look back, we'll see a whole range of foreseeable and unforeseeable errors that have been made. But Scotland has fairly consistently been to the, I guess, what you might call the more cautious side of the spectrum. What this has thrown into sharp focus, and this pre-existed the pandemic, is that health and safety, public safety, and all the issues that surround that in Scotland are what we would describe as mixed competences. So health and safety itself is a reserved competency. It's set by UK law. It's to some extent policed by the Health and Safety Executive, which is a reserved body, but it's also policed by local authority health and safety inspectors, and there's also a whole range of legislation relating to public health, environmental health, and other areas where people in Scotland, companies in Scotland, are expected to adhere to devolved Scottish legislation rather than UK legislation. So what we've seen really for the first time is the coming together of public health and workplace health as an issue in itself. And that, in our view, has not only meant that workplaces in Scotland must listen more carefully to what Scottish legislators, Scottish partners believe, but will have to do so in the future too. So when we think about this pledge, we're looking at something which, in a sense, should be being done anyway, because as the point was made earlier, we should be adhering to health and safety law anyway. But now there's a much more public interface and many more obvious reasons in Scotland for an employer to want to sign up to that, because they're able to project a general position on public health, on consumer health, and various other areas, which previously would have been seen as more separate. So in Scotland, to sum up, in Scotland, things have been somewhat better. But what's really important in this period ahead, particularly with the changes to testing and other protective measures, is that we're able to use this pledge as a way to concentrate the minds of employers around those various responsibilities they have, which go beyond the simple responsibility to workers in their workplace.
So thanks for that, Dave. And we'll now come on to the pledge and talk about the pledge in a little bit more detail. But first of all, I really want to echo a very simple but really powerful point that Dave's just made, and which we made before, which is that what we're asking for is remarkably modest. All we're asking is that employers obey the law and that the government enforces the law. It's an odd situation where we even have to be demanding that, or where some people think it's controversial. It would seem to me that it's something that should be taken for granted. So the pledge is one of the means by which we hope to complement the other work that trade unions do in negotiating and working on these issues. It's a means to raise the issue. And in many ways, it's complementary to one of our other initiatives, Scores on the Doors, which is about ventilation. So the two complement each other, although they are somewhat separate. They have a separate focus to allow us to focus on slightly different issues. So we're going to continue talking to Dave and to Ceri, but Janet is going to address the specific question of the pledge and campaigning on the pledge.
Yeah, thank you. And thanks, Dave. I think you're absolutely right. Workers' health is public health, and that is going to impact on both our communities and our workplaces. So how do you think that the safety pledge can help improve health and safety in the workplace?
Well, certainly I guess I'll speak briefly, Janet, from a trade union perspective, and then I guess a more general perspective as well. From a trade union perspective, it's a tool. It's a statement that a company makes, or we can ask the company to make, which, as we've said a number of times, shouldn't really be that difficult if they wish to comply with their responsibilities under the 1973 Health and Safety Act. They must do certain things and they must consult with workers about what they do. But it's a public statement that we're able to bring to the employer where trade unions are already represented, offer it as a positive opportunity for them to say positive things which will project good things for their workers and good things for the public with whom they engage. But yes, obviously at the end of the day, it's something which we are then able to negotiate with employers about, to say this is what this means in practice. This is what you should be doing in practice to protect your workers and to protect the public. From a wider perspective, and let's remember that lots and lots of small workplaces and some large workplaces don't enjoy trade union representation. They give the opportunities for workers who aren't trade unionized to talk to each other about how they might approach a company and do that, a process of collectivization. But it also provides the opportunity for consumers, for public bodies, for government, for local authorities, a whole range of stakeholders to ask the question, why would you not do this? I want to be positive about this. I think it's a genuine opportunity for employers to sign up to something which is for the general good as well as their own commercial and general image. But of course, the bottom line is, if somebody isn't prepared to sign up to this, it's a legitimate question for the workers and public to ask, why not?
Thanks, Dave. I think that's a really good point, And Ceri, how do you think employers will respond to the pledge?
Yeah, well, personally, I'd like to think they'd respond positively to it, really, Janet. I think it's a good statement of intent, and it reflects what employers should be doing anyhow. And as Wales TUC will be approaching the employers' organisations like CBI Wales, FSB and others to talk about it. But I think it would be in companies' best interest to sign the pledge. There's well-reported instances of labour shortages, particularly in some of the most important sectors when we think about public-facing institutions like in retail and hospitality, you often, there's reports and you'll see walking down the street that there are vacancies in those sectors. So if those employers want to attract workers to a safe environment, I think this would be a benefit to them as well. So yeah, I'm optimistic that employers will be enthusiastic about this pledge, and certainly trade unions in Wales will be approaching their employers to ask them to sign up.
Thank you. Just a final, Dave, can we involve staff, service users and consumers in promoting the pledge?
I'd really like to think that we can. Obviously, we know there's a range of active organisations who are particularly concerned around this. We know there is organisation amongst people who are likely to be particularly at risk from COVID in the next period, and I guess that would be the starting point. Again, a tool for people who have genuine and well-founded concerns about where they go and how safe they feel when they get there. So I'd like to think it would be a very useful consumer tool, as I say, in particular where communities and organisations are already organising around this key aspect of public health.
Thank you.
Steve, you're on mute. Steve? Right. While Steve tries to get himself off mute, Steve,
I am muted.
Steve, you're back.
Sorry about that. Something strange happened on my laptop. I normally know where by now, after 2 years, where the symbol is. So let me conclude. First of all, with huge thanks to Janet and to Tracy, Ceri and Dave for their contributions. And I hope that won't be the last of our contact, and we'll be working together specifically on the pledge into the future. And let me just finish by some very practical things about how we aim to promote the pledge. And just to repeat that the pledge is both a general pledge by employers to make the safety of their staff, their customers and users a priority, and then a specific emphasis on giving the necessary support to workers to stay at home if they test positive. And that means not only not telling them to come in, it also means providing a test so they can find out whether they are infected or not, and secondly, giving them the financial support so they're practically able to stay at home. It's incredibly important. Who wants an infected person in their workplace? If you go into a shop and specifically if you're vulnerable, how can you go into that shop if there's a danger that somebody is infected? So things we're going to do and the things we're going to ask you to do. What we're going to do is we're going to put the pledge on our website, and we will be contacting a number of employers and asking them to sign it. And that too, the names of those organisations we will put on the website. And we are confident there are many good employers out there who will want to sign, to say to people, we will create a safe environment, and therefore make people feel confident that they are able to visit those places. But if equally we discover that there are organisations, that there are employers who not only don't sign the pledge but are requiring their workers to come in when infected, we think it's really important we know about that and that it's challenged. So we would ask of you, of everybody who's watching, to do two things. First of all, go to your employer and ask them to sign the pledge, right? And you can email us and contact us through the website to let us know. And secondly, if you have evidence of employers who are requiring people to come to work when infected, please let us know that as well, so that we consider publicising that and challenging those actions. So the pledge is going to be an activity which we'll be involved in, which we need you to be involved in to make it work, and we'll be working with the unions to make a success of it as well. So thanks very much, and thanks for listening.
Thank you, Steve and Janet, for that really thought-provoking session, and to our guests for that their insights on this discussion around workplace safety. I think, I mean, it seems we're in a situation where just about everybody is doing the government's job, but the government, with regards to keeping us safe. But it is what it is, and it's really helpful to have that workplace pledge. So do sign up to it. Now, we've only got a little bit time left, but this is one of the reasons we have the Friday briefing, which is it's over to the public and to the press for their questions. So without any further ado, can we have our first question from Neil Lawrence? Neil, are you there? Hi, Neil.
Hiya. Yeah, my question is, how will my work colleagues who are on low pay, who cannot work from home, know when to return to the workplace after a bout of COVID if they cannot afford lateral flow tests?
Of course, that's a very, very timely question. I'm going to, first of all, very quickly go to our guests, because this is exactly what we've talked about before, if we have time, coming back to our members. So, Tracy, do you have something to add here about how can, you know, what will work colleagues do if they can't afford lateral flow tests?
I think, as I said in my comments, the first thing to do is to join a trade union and to collectively put demands on your employer to say that you demand not only that they provide resources to pay for the lateral flow test themselves, but also remaining to argue for proper PPE, face masks, FFP2, etc. I think that's the only way forward, really, because a nice sort of argument and a nice proposal put to the man is not going to cut it. I think organised to demand the right to that.
Thank you very much. Professor Susan Mickey, do you have any thoughts about this, that if people can't afford lateral flow tests and they might be symptomatic, they might not, well, they might be symptomatic, might suspect they have COVID, what should they do at the moment?
Well, my understanding of the number of days that people are likely to be infectious for, and I can be corrected by my colleagues if I get this wrong, is anywhere between 1 or 2 days and 14 days. And you don't, as an individual, you don't know how many days that's going to be for you. But a rule of thumb is for people to stay at home for 7 days after they've started having symptoms. So they should definitely stay at home if they're symptomatic. But if they've got over their symptoms, 7 days. Now, I know it got cut down to 5 days. So maybe the virologists amongst us can give chapter and verse exactly what it is. But I do think it's a really important question, because without easy, affordable tests now, we have to go by rules of thumb. So I think we need to get the word out to people. What's the rules of thumb that people should be abiding by?
Thank you very much. And Dave,
Steve Griffin could answer that.
Sorry?
Maybe Steve Griffin could answer, you know.
I think Anthony had something to say, Guy.
Oh, did he?
Oh, I'm
okay,
sorry.
great.
I'm sorry. I missed you, Anthony, there. Anthony, would you like to add something here?
Well, the absence of free testing is just one more removal of the key pillars of public health for this epidemic, which is still ongoing. Recently, our Secretary of State for Health, who is a banker, said that people who think they have COVID should, quote, socialize a bit less. And then when he was told about the recent rise in cases, which has been laid out by Christina today, no particular cause for concern. If you remove free testing, you can't control a virus infection if you don't know where it is and how it's spreading. And free tests are an absolutely basic principle at the NHS, that you have test free at the point of delivery, and you need a rapid diagnosis from a test if you want to make use of the antivirals, because the longer you wait to use them, the less effective they are. You know, it's going to be £10 for a pack of 5. Yes, there are a number of exemptions, but people have got to go and claim their exemptions. I would like to see a policy whereby GPs can actually prescribe LFTs for free to any group that they feel would benefit from it. But I think ultimately we should retain free testing, and I think it's just going to add to the reality that we're still in an epidemic. We've still got ridiculously high levels of infection, and it's all part of the out of sight, out of mind policy that this government seems to pursue.
I think those are very, very good points, Anthony. And of course, the problem with saying that GP should also give it out, and you're absolutely right in a way that they should, but at the same time, the more a person travels when they've got COVID, the more likely they're to spread.
Yeah, just to add, a single mother with 2 children is after the recent budget or spring statement is 17.5% worse off than before. Add on 8% inflation, you're down a quarter of their income. And they are the most borderline. I mean, there is going to be there's going to be hunger. There's going to be even malnutrition amongst children in this country in the coming year. We haven't seen anything of the effects of the Russia-Ukraine stuff on fertilizer, fuel and everything. We've seen a bit of it, but it could get much worse.
You're absolutely right, Anthony. Thank you very much. Now, I know, Steve, I can see that you're trying to get in, but Steve, if you just bear with me just for a second, I'm going to just go on to the next guest because I'm really conscious we've got guests waiting, and I will come back to you, Steve. So do we have Jackie Power with us today? I understand Jackie has a question for us.
Yes, hello everyone.
Hi,
thanks for taking my question. I work as a community doctor in child and adolescent mental health services, seeing children and adolescents in clinic with their parents sometimes, and also individually in schools. Despite open windows and social distancing at work, not all children wear masks, and I'm exposed on a daily basis. I managed to stay COVID-free until March the 4th this year. I've just returned to work with the knowledge that I will be exposed again. Some children and adolescents are experiencing their third infections. I'm wearing surgical masks in clinic. How can my employer keep me as protected as possible going forwards? I'm over 55 and not eligible for the 4th booster dose. Thank you.
Some really interesting issues and really alarming issues that you've raised there, Jackie. Steve, I'm going to come back to you. No, let's start with you, Steve. You had something to say, and if you want to say something back to Jackie as well, please do. But then I'm going to go to you, Danny. So, Steve.
Sure. I mean, I think this is a major issue. I think there's been a lot of campaigns amongst healthcare workers in hospitals, certainly, to get the right PPE, to get filtering masks. It's pretty clear that from a protection point of view, a surgical mask really isn't good enough. So yes, I believe that NHS should be providing GPs, especially with the number of different contacts you're going to have throughout the course of a day. You should be getting proper PPE which is protective for you, because that, you are at risk, you are exposed. And Christina showed different workplace occupational hazards in terms of the number of people that are getting infected and developing long COVID as well, we've heard before. So this really is a problem, and it's something that needs to be urgently addressed. And it's just, thank goodness that they did decide to provide flow tests to healthcare workers eventually.
Thank you very much, Steve. Danny, have you got any thoughts on this?
Yeah, I'll just add one sentence, which is probably unhelpful, because I've got relatively little comfort to offer. This being April the 1st, I think our major mitigation at the moment is wishful thinking, and all of the assays that we're looking at in people who are some months out from their booster are actually baseline against Omicron. So I've got nothing helpful to say to you about your residual immunity, except that that residual immunity will hopefully see you through from any severe infection, hopefully like the rest of us. And apart from that, we're back to the best masks they can offer you, the best ventilation they can offer you. And I've got no other bright words.
Thank you very much, Danny. And thank you, Jackie, for your question. Now, I'm conscious of time, but I want to squeeze in. One of our guests was unable to make it today and was really hoping to make it. So I'm going to squeeze her question in before we wrap up at 2:30. And this question is from Catherine Penrose. And she asks, can you give us your take on the 3-day isolation for children under 18? As a pediatrician, I am overwhelmed at the inadequacy of the time frame, but the infection can last longer with children. How can we send our children back to school infectious? Christina, and then Steve. Could we hear your thoughts on this?
Well, I mean, I think it comes down to the fact that the government has never seemed particularly worried about children getting COVID. I think that's wrong. I think that's a mistake. So, I mean, it's difficult. Like if you're going to get fined by your school for not sending your child in, then I'm not sure what you can do. But personally, I would try and keep children off for at least 5 days. And I think the one thing, you know, that people aren't really acknowledging enough of is the fact that teachers and other school staff are one of the most exposed professions and have some of the highest rates of long COVID. So there are consequences to allowing high rates of infection in schools, both for children and their parents and the people who work in schools.
Thank you, Christina. Steve, sorry, just before I come to you, I'm conscious we haven't heard from Deanan. Deanan, do you have some very quick thoughts on this? And then we'll go back to Steve before closing.
Well, thanks. Well, in Danny's words, very difficult to be positive about this. But a general thought before Steve comes in is that, you know, one of the opportunities we have, having lived through COVID, is to have a different way of thinking how we can protect ourselves and those around us. It's been a huge advance, not only the vaccines, but having high quality lateral flow tests, easy to use, everyone can use them, is a real advantage, not only for COVID, but a whole range of other infections. Think back before COVID, you know, we weren't diagnosing ourselves in the community for flu or respiratory syncytial virus. We were going around, many people were going to work, forced to go to work because they couldn't have sick pay, as Christina has talked about, but nevertheless, that was the situation we're in. And it seems where we're going now, where government wants us to go, is back to that situation, whereas in fact, the opportunity here is to have a much more sensitive way of us protecting ourselves and others. And that's the collection of things here that we're going through. In fact, I should say, you know, I fear for the derogation, the downgrading of infection control in hospitals. Yes, hospital NHS workers will have access to lateral flow tests, but my understanding is the criteria at the moment for members of the public, patients going into hospital for elective procedures where they were previously obliged to have a test before they went into hospital in order to control hospital spread, is going to disappear as a way of overcoming some of the sort of real problems in terms of waiting lists and so forth. So all of these things, we're almost like going backwards rather than actually considering how best we can use these tests, the ability to test for these. I see that there's a new test that's been just recently come out that tests not only for COVID, but also flu together, a point of care test. These are opportunities for the future where it seems we're not going to be taking advantage of them. That's not answering the questions of Ada of the fantastic questions. It's not reassuring, but it is, I think, something that we need to campaign for together with our trade union colleagues for making workplaces safer.
Thank you very much, Dean. And Steve, you will have to forgive me. I'm going to have to close now unless you want to say something really urgent. Is that okay? Great. Thank you so much. Well, I'm afraid that's all we have time for today. I want to say a huge thank you to all our guests for joining us today. And thank you to my fellow scientists who are here every week on a voluntary basis. So thank you all. We also want to thank you, incredible members of the public who send us feedback, email us questions, join us and continue to support us every single week. We're very grateful for your continued support. Now, today we announced the safety pledge during our session. That will be up on our website. And we're also inviting all interested employers, owners, as well as any member of the public to sign up to this pledge. Anyone who's interested in finding out more about this pledge, please do contact us through our website. So that's it for today. We will see you all next week, same time, same place. In the meantime, take care, stay safe and keep well. Thanks. Bye-bye.
Bye all. Thanks very much.
Bye everyone.
Bye.